Hey, thanks, Max. Hello, everybody. I hope you got a nice break, or at least a little bit of a break over the last week or so. Unfortunately, Omicron did not take a break. I think you've been reading this and seeing this in the news over the last couple of weeks, and Connecticut has been no exception. Our infection rate over the last few days is 10.7%. So that's probably, the highest since we've done real testing. About 9.8% is the 7-day average. So it continues to tick up. We are less than, all of our neighbors. Big deal. The virus is continuing to infect people. We have 88 more hospitalizations. That's concerning. We're up at about 925 hospitalizations. We were about 1,200 a year ago, but we are, creeping up in the wrong direction. So this is something we pay special attention to. Some silver linings. Our hospital admittance, the number of people going into the hospital has been flat over the last week. We know that the first country hit by Omicron was South Africa. We see that their infection rate has come down, so it's steep up and steeper down. I think we're seeing a little bit of flattening in Britain, so we'll see if those are early indicators of what Omicron might mean. That said, I think we learned a year and a half ago, it's great having the federal government as your partner. It's great if they, really have a supply of goods that we need. And I know they've made promises in terms of 500 million, fast tests and as such. But in the meantime, we tried to take the lead ourselves. And I saw, the urgency a lot of people felt on their way to vacation to get testing, now on their way back to get testing. First of all, we just got off the phone, we being about 20 governors, with the president, ramping up more testing capacity. You could Google COVID test near me, COVID test near me. We have 400 sites where you can get tested. We have close to 1,000 sites where you can get your booster shot. So keep that in mind. That said, we also know that there's a real supply chain crunch out there, and we're doing everything we can to alleviate that. That said, we've been working on this a little bit. So you maybe heard, I think the good news that Connecticut's at the front of the line and able to announce that we'll have 300 of the fast-acting, tests available by the end of this week, at least in the state. And we'll be getting those distributed. That's 3 million. And hopefully that's a bridge to when the feds get their 500 million on a nationwide basis. But I just can't wait for them. This puts us at the head of the curve. The 3 million, what that means is, and Manisha and Josh are here to explain in detail what our strategy is. But we're going to have 1 million of these tests made available to our municipalities and their local health departments to get that distributed, hopefully starting within a week. And that means in terms of some of our hardest hit populations, some of our congregate settings, some of our homeless shelters, make sure those fast acting tests are there so we can make sure that that you're safe. If you're not safe, how to make sure we keep you quarantined and keep everybody around you safe. And I think you appreciate how important I believe, and I think most of you believe, keep our schools open safely is. I think we were one of the first to get our schools open, close to a year and a half ago. Our schools were all open this last year. But let's face it, we see the spread of Omicron. We see it's hitting some young people. And we want to do everything we can to make you as parents know that your kids can go to school safely. Your kids can go to school safely. Teachers and parents know that they can be at school safely. So of our 3 million, fast tests, 2 million is going to be going to our K through 12 schools. And we'll be getting that distributed, within a week. And I hope that means that, if you, mom or dad, want your kid to be tested, we have a test available for you. They can take it home. You can administer that test. About screen and save and also test and stay. That means if somebody was exposed, we'll be able to do the testing on short order to make sure we can keep our schools open. I just think it's a number one priority for me. A, for our kids and their learning. B, for our kids and their mental health. C, for their parents to make sure they can rest at peace knowing that their kids are safe, and allows them to get back to work or stay at work, how important that is. We don't want our economy closing down. We don't want to lock down. And I think anything we can do to keep our schools open is really key to the kids and their parents keep working going. Along with that, Josh and our team at DAS have been very careful in terms of our stockpile, not simply relying on what's coming out of Washington. We've done that before. So we've got a fair number of masks, including 6 million N95 masks. That is the best mask you can get. And Josh and DAS and Manisha are going to be distributing those 6 million masks to our municipalities as well, so they can get those masks out to you. Look, let's face it, given the amount of community spread right now that we have, nothing more important than wearing that mask. If you're used to wearing a cloth mask, step up, get the N95 mask. If you're in that congregate setting, much better off wearing that mask. We'll be getting those soon thereafter to our schools as well, doing everything you can, like I said, to keep our schools open. And this is part of how we continue to manage our way through Omicron and what will be probably another variant as they come along. That is, we learn to manage through this. We learn to manage through testing. You got symptoms, you feel like you're at risk, you've got the test going forward. You probably see that the FDA has just approved, for 2 of the therapeutics. 2 ways that you'll be able to take the Pfizer or the Merck pill regimen and keep you out of the hospitals. The number one criterion for success and what happens next is keeping our load down in the hospitals so we can keep our hospitals open and keep you safe and keep everybody that needs access to a hospital. I think testing as the month of January goes on and the therapeutics will be very key to making sure we can manage our hospitalization in a real way, keep our schools open, keep our economy open, and keep you safe. I think I'll leave it at that right now. We've got a fair number of questions, and Josh and Manisha are there to help us.
Once again, if you do have a question, please make sure to raise your hand. And we're once again joined by Josh Jabal, with the Chief Operating Officer of the State of Connecticut, also our DIS Commissioner, and with Manisha Jutani, Commissioner of the Connecticut Department of Public Health. We will start with Channel 3 Eyewitness News.
Yes, Governor, since these masks are not supposed to be used and reused for days on end, how long should this 6 million supply last us?
Well, I think I'll pass that right over to Josh, but I think 6 million masks is enough for, I would like to think, a couple of weeks. And the good news is in our New Britain warehouse, we do have additional masks. So I think that supply is not going to be determinative. And by the way, there's no shortage of masks. You can get masks online. You can go to Amazon and get masks. You can get N95 masks. So we're doing what we can to help those get to the front of the line, and you can help yourself. But Josh, anything to add to that?
Yeah, we're surveying our municipalities to see how many they'd like and they want to distribute. But I think we have many more than this in our state stockpile that we built up last year. So if there's demand for more, we can distribute more. We're not going to be limited by our supply. We're going to calibrate to what the municipalities ask for their constituents.
Got it. And Governor, my last one, I just want to revisit this question that I asked last week. Do you think reinstating the mask mandate could also curb the spike that we're currently in?
Well, it's not curbing the spike down in New York City, which is probably ground zero. If I think about things, I certainly think about nursing homes and other congregate settings where I think the booster shot is probably, number one priority to make sure everybody that can be boosted is boosted there. That would be my next priority.
Thank you.
We'll go next to the Dave New London.
Thanks, Max. Hi, Governor. We know schools are getting 2 million tests. Is there a specific number of masks set aside for schools?
The timing on that, Manisha?
So as was mentioned, we have a number of different masks that are in our stock already. And we are in very preliminary phases of just having secured the tests, are in the process of discussing with our education colleagues, and the decisions on how many masks schools may want and need will be determined in the days going forward. But what we can say based on the stockpile that we have in the state is that anybody in the state of Connecticut that wants a mask will be able to get a mask. I also would just say regarding N95s, that single use is really determined by, in hospital use and when you're dealing specifically with somebody who is infected with COVID-19. If you are going out and going into a store for a few minutes or 10 minutes or something like that, you could use that mask for the duration of certainly a day. So I would just say that when we say single use, I think we can also keep that in mind when it comes to public use versus hospital use.
Thank you. And just one more question. How will people be able to get these masks and tests on a ground level? Like, do you foresee people going to a designated spot in municipalities to pick them up? How's that going to work?
Yeah, so we are in discussion with our municipal partners, and the earliest that they would start receiving these tests would be Thursday. And then it's going to be up to our municipal partners to determine how that distribution will work. So I just ask for some patience for people in the community as we sort this out with local community partners and the municipalities, but it's going to be determined by each local municipality what's going to work well for their community.
Thank you.
Jane Caffrey from NBC Connecticut.
There, thank you so much. People are pretty desperate for these tests. Do you have a plan to keep crowds organized when people show up to get the tests?
Keep going, Manisha.
So we understand that desperation. That is the reason we've all been working so hard to be able to get and secure these tests for the citizens of Connecticut. We are at this point, like I said, really still in rolling out phase in terms of how this is going to be operationalized. And every community is going to be slightly different. At the state level, we have been working to get a hold of these tests and figure out that distribution mechanism to local municipalities. Every municipality is going to have a different number of people they're going to have to consider. They're going to have different considerations within their own community of prioritization of distribution of these tests. So in terms of management of people and that distribution, it's really going to be up to our local partners. And because of that, we really do need people to have some patience to be able to work with municipalities as they try to figure all this out, given that we were just be able to secure these tests as well and give them notice of that.
And people are finding it really tough to get testing appointments. We've seen the lines. People are waiting in some cases 4 or more days for results. Is there a plan to increase testing across the state aside from the home tests?
Well, I can start. I mean, our hospitals and pharmacies and fairly qualified, we're expanding testing through all those traditional channels. But 1 million tests made available within the next week. That takes a lot of the stress off of the testing load. I mean, we're doing, say, 280, 300,000 tests a week. That was before, after Christmas, a lot of demand there. So I'd like to think that people know we've got the testing capacity. They obviously know we've got a mask and PPE. So hopefully that brings down a little bit of the rush. But we've got the capacity for you and to come in over the next week.
Thank you. Last question for you. Some school districts are already opting out of screen and stay. At least 5 have so far. How do you foresee that going forward if more of these schools revert back to the traditional quarantine method?
I'll start and then pass it over. The White House, the COVID task force have really made an emphasis upon screen and stay and test and stay. They know how important it is that just a passing exposure should not shut down a class or shut down a grade. I think that is too damaging. Given the nature of the community spread, I think you'd see our schools likely to be shutting down all too frequently. So I think that the test and stay and screen and stay are ways that you can have your kid in school safely and keep the school and your kid's class open.
News 8.
Good afternoon. This is Jody Latina. Governor, where are these tests coming from and what will be the requirement? Will folks have to show that they are a resident of that town or that community?
I'm going to pass that over to Josh, but a real hats off to the entire DAS team led by Josh Jabal. They took the lead on this, sourcing this. Remember, we had to do this, Jody, a year and a half ago when it was mass and we were scrambling all over the globe. And I'm really proud of the team getting us to the front of the line. So how do they get distributed, Josh?
I also want to acknowledge the great work that Commissioner Giuthani and her team have done as well in helping to identify and source these along with the DAS procurement team. Is a great team effort. And as the governor said, another good example of why being able to operate quickly and flexibly in this type of environment is very important. I think, again, as the commissioner mentioned, the municipalities will set out the rules for distribution within their towns. I would expect that proof of residency would be required to pick up in your town, so we don't see people shopping around from town to town. But again, we're going to see a lot of supply of these tests coming in. There's going to be distribution through schools. So again, we'd encourage people to look towards midweek. Look to your municipality for guidance on distribution logistics, probably by Wednesday or so.
And where are these tests from? Is it a specific brand?
Yes, it's called iHealth, and it's from iHealth Labs, which is one of the COVID diagnostic testing companies, which has emergency use authorization from the FDA.
And Governor, a final question for you. Did President Biden say anything on his call with the governors about the Defense Production Act being invoked for these at-home tests?
He did say, as needed, we were going to do it. We're going to do everything he can, meaning he was going to do everything he could to make sure when it comes to testing, vaccinations, therapies, it's all hands on deck and we mobilize. And that includes the Defense Procurement Act, Jody.
We'll go next to Christine Stewart, CT News Junkie.
Good afternoon. So I'm just wondering, when was the decision made to, obviously you need to get a hold of these at-home tests, and there's obviously been some supply chain issues lately. So when was this decision made? Because other states had moved forward with this, like Massachusetts and Colorado, and at the time you were not necessarily on board with that.
Want to walk us through, Josh?
Sure. So Christine, because you follow these things closely, you may recall at the last press briefing the governor did, I think a week or so ago, we made some reference to, this is a topic that we were working on. So we've been looking for a while to secure this inventory. Final decision was made Christmas Eve. The team was working straight through Christmas Eve. Governor signed off the project then, and the final purchase orders were cut over the weekend.
Okay. Was this difficult? I mean, was it difficult once you made that decision to actually get the supply of the test?
Yes, these are in high demand. So it has been a aggressive search by the teams to secure the supply.
So how did Connecticut kind of, I guess, get to, you keep saying we got to the front of the line. How did we do that?
Hustle and persistence. As the governor mentioned, the DAS procurement team has a lot of experience from early in the pandemic when we were tracking down PPE from non-traditional suppliers, built a lot of relationships and networks of people who knew how to source hard to access and scarce commodities like at-home testing is now. We leveraged one of those relationships to get this done.
Okay. And schools, are you worried about, I talked to Fran Rabinowitz before I left, and she said she's really concerned about having enough school staff that, schools may have to close because they are not going to have enough staff that are healthy enough to obviously teach the children.
Well, some of that, Christine, is confidence as well. And I'd like to think that given the fact that we're going to get, most of these kids tested, not to mention teachers as needed, not to mention the fact that, we've got all of our teachers vaccinated and now boosters available. They can teach safely. a lot about getting people to work and keeping it working, giving them the confidence that we can do it safely. I'd like to think this is a gesture that says that.
Go next to Frankie Graziano, Connecticut Public.
Governor, it's Frankie Graziano. I just wanted to follow up. I think it's kind of similar to what Christine was asking. We're looking at the recent budget that was passed, and I understand that a lot of that had to do with federal COVID relief dollars. And I know that this plan, I think it calls for something like 18.5 million for those COVID relief dollars. How has that impacted this rollout? And I guess the larger question is, could this have been done sooner with some of those resources?
I guess anything can be done a little sooner. I'd say, as Christine, alluded to, we are the first out of the box in terms of states. I think we were able to move quickly, as Josh alluded to. We're able to move quickly because we could pay 18.5 million. We could move quickly because, like it or not, we had the executive orders that allowed us to move quickly and secure these tests on a very timely basis. Remember, there were no at-home tests 8 months ago. This is all a relatively new technology. They've been ramping them up over time. But you're absolutely right. There is now a scramble, just like there was for masks a year and a half ago, to see who can get access to the tests. And it was a nice Christmas present. We got that access.
And then I guess to follow up there, we're talking about potentially a rush having been done around Christmas Eve for these to get out. Did we miss the boat in a sense? Could this have happened maybe a little bit earlier so that we could have beat this Christmas testing rush?
Frankie, I think in hindsight, everything could have been done earlier. Omicron only happened, a month ago. We only knew last 2 or 3 weeks exactly what the nature of the community spread was going to be. So, generally speaking, I really salute the team for moving as quickly as they did.
Thank you, Governor.
The Connecticut Mirror.
Thanks, Max. Hi, everyone. How are we going to know our testing positivity rate now that people are doing the tests at home?
That's a really good question, Manisha. The numbers are skewed a bit. You want to speak to that?
Well, I think there are a few things that we know. We know that the testing positivity rate is sort of an indicator as we see it going up. We know that trajectory is certainly in the upward trajectory. We know that our denominator of tests, numerator of tests, is not going to be accurate anymore in terms of the number of self-tests that are done, because they're not going to be included in that. But it still does give us a reflection of what's going on in the community. So I do think that the daily positivity rate is going to be a bit of a skewed number in some ways. I don't anticipate it to go down very quickly. I would not be surprised if it stays at the level that it's at for some time. But I think that at least what we're doing is providing people with the tools to be able to know that they need to stay home if they're symptomatic. And really, quite frankly, even if their test is not positive, but they have symptoms, they could have the flu or some other virus. Just stay home if you don't feel well, regardless. And so I think that this is just another tool, particularly in the context of COVID spread, to be able to help people identify quickly that they should get out of circulation to be able to help prevent spread of more disease.
Okay, and are state employees who opted for testing instead of vaccination going to be able to use these tests to meet that requirement?
Josh?
At the current moment, the rapid at-home tests are not eligible for compliance with the vaccine mandates. So we continue to provide on-site testing, for a number of our larger agencies like Department of Corrections, and then the other 400 testing sites are still available for folks to access.
Okay, and regarding distribution of these tests, are you giving any guidance to municipalities, specifically in terms of, I guess the commissioner said people should take only the kits they need for their immediate family. I mean, how do you define need? Is that one test per person? Is it two? And after how long might people be eligible to grab another kit if they're going through them quickly?
Yeah, again, we're gonna leave that. We're leaving that up to the municipalities. I think they're going to have the best gauge of what demand is going to be in their community, and can ration these out accordingly. And again, we're going to be in close contact with them as we were this morning. And if we see demand for more, then we'll be back out in the market trying to source more.
Okay, thanks. One last question. In terms of equity efforts, is there going to be any prioritization of any group or area to receive the tests or masks?
Yes, so we are, as part of this first group of 1 million tests, we are allocating some of that supply to populations that we know may have harder access to be able to get at-home tests on their own. So for example, we are going to be allocating some tests to homeless shelters, to other congregate settings, to we're working with the Connecticut Food Share team to get some tests distributed over the next week with individuals who are collecting food distributions. And we're also meeting with clergy to determine if there's opportunities to help distribute through places of houses of worship as well.
Thanks, everyone.
Welcome.
We'll go next to Sue Haigh from the Associated Press.
Thanks, Max. Good afternoon, everyone. Governor, I was just in Colorado, and there it's totally different. Like, you can sign up to have these free tests sent to your house. And also in Colorado, you can report your results. It sounds like you guys aren't going to do that at all. I wondered your thinking of going this route in terms of distributing everything through the municipalities instead of sending tests directly to people's homes.
Well, I'll start with that, Sue. Tests are a real scarce resource, and a little like vaccinations were a year ago. You want to make sure that none of them go to waste. So rather than just sending a test to everybody's home, we thought it made sense to be discreet about how it's being distributed. A lot of it's being distributed to underserved communities through our municipalities, most of it being distributed through our schools. Again, parents will say, I'd like to have a test or two for my family, for my kids, to make sure that they're safe. We know those tests are going to be used. We get a result on it before something else comes back. So I think when you have a scarce resource, you want to make sure it's used very judiciously. And I think Josh and Manisha are doing just that.
And also, thank you. Is there a way to figure out the likelihood of hospitalization now compared to before we had vaccines, just in order to put these numbers of infections in perspective? Because I think people might be getting kind of scared by some of these numbers.
Well, I'll start. Look, we still have 80% of the people in the hospital, and that number, has gone up quite a bit over the last month, are unvaccinated. Only 10% of our people or so are unvaccinated, yet they're 80% of the hospitalizations. I think that tells you in no uncertain terms how the vaccination, especially vaccination with a booster, keeps you safe and keeps you out of the hospital. But anything to add to that?
Yeah, I mean, there's so many things that are different than this time last year, but just in terms of the raw data of where we are sitting here on December 27th, compared to this time last year, we've got about 30% more cases being reported each day than we were at the peak, but we're about 30 to 40% fewer hospital admissions per day. So that tells you a pretty compelling story of how important vaccines are, in particular, to keeping people from getting severely ill and staying out of the hospital. And as governors pointed out many times, the vast majority, just did point out, the vast majority of those people who are being admitted are people who are unvaccinated.
Great, thank you very much.
Time for maybe one or two more. We'll start with Jordan Fenster from Hearst, Connecticut Media.
Thanks, Max. I wonder if there's a companion effort to encourage people to isolate if they test positive, and how that jives with the governor's intention to keep the economy open and to keep kids in school. And then also, contact tracing. Is there a companion effort to maintain contact tracing so that we can, find out the disease transmission?
I'll start and then hand it over immediately to Manisha. When you've got as many infections as we have, as New York has, as New Jersey has, Massachusetts have, contact tracing gets a little more complicated. So, but we are doing, the best we can on that front. As you see, the White House lowered from 10 days to 7 days in terms of the amount of time you have to spend off the playing field, so to speak, if you have that exposure. But I'd like to leave it to Manisha in terms of what it looks like going forward.
So a few things. When you have this much community spread, contact tracing does get more complicated and in some ways less meaningful, but we are still very committed to being able to try to alert people if they have a positive test, what to do, and how their contacts should be notified as well. And so we are actually working on text messaging as well when somebody has a positive test, to tell them what to do and how to isolate, as you mentioned, which is the most important thing you can do to prevent spread to others. And I think that those efforts are going to, be able to help us keep those people who are in school and in the economy who are healthy. And that's what we want to be able to do, is that when you're not well, is to be able to stay home and recover. We know right now that the CDC has changed guidelines specifically for healthcare workers. It is possible that over the weeks and months ahead, that will change further. But right now, we have to go with what they've offered so far in terms of the changes that we can do in our economy.
Thank you, Commissioner. I just also wanted to ask real quick, just to clarify, these 1.5 million test kits are separate from what the Biden administration is going to be distributing, or is that part of this effort?
No, this is very separate. This is using state funds, and the goal here was recognizing the tremendous spike in cases that we've seen because of the high transmissibility of Omicron, and recognizing that people are gathering during this holiday time period, and the push to get this done and get this out into our communities as quickly as possible, separate from what the federal government is offering in these weeks before federal test kits will be available, is to be able to try to identify people quickly who should stay home, who might have been infected over this holiday season, and specifically be able to try to roll out these tests to our school communities as quickly as we can, so that we can keep kids and staff in school, so that in-person learning can continue, because we know how critically important that is.
Thank you.
Alicia Machado, Fox 61.
Good afternoon. I wanted to ask, how will the tests be distributed to municipalities? For instance, will it be based off of population?
It is based on population. Anything else, Josh and Manisha? You got it.
Yes, that is the main thing, except for the additional vulnerable populations that we've identified, which may have additional distribution.
Thank you. Also a question for Governor Lamont. New Year's is coming up as we're experiencing this surge. So what is your message to people who are thinking of gathering this weekend?
Be careful. Look, this is accelerated a lot faster than I think anybody anticipated. You do know that you can be vaccinated, you can be tested, and if you're in a close congregate setting, there can be some spread. Know who you're with. Be careful about that, and any chance you have to be outside, it sure is preferable.
Thank you very much.
News 12 Connecticut.
Good afternoon. I know that the municipalities will have discretion, but just for what people should expect, are they going to be looking to go to a town hall or a testing site, or will it be broken into community centers or churches? And how long do you hope this stock of tests will last?
I can start with that. Please don't call town hall in an hour. It's just going to be one of those mob scenes like we have early vaccinations. They're going to have all that information up on their website. It'll be easily accessed. Each town sort of knows the particularities of their community, I think, in terms of how the masks and the tests will get out there. But anything else to add to that, guys? Seems
No,
okay.
I think that's exactly right, Governor. Just encourage people to be patient for a day or two, and your town will get information out. And each town's a little different in terms of the best place to distribute things like this. So stay tuned.
And do you have any sense of breakthrough cases percentage wise or breakthroughs with boosters? Is that something that you're still able to parse out?
Manisha?
So yes, certainly we know that there have been breakthrough cases. We do report the percentage of breakthrough cases that we've had in our daily and weekly reports. We have about 1.5 roughly percent of total vaccinated people that have had breakthrough cases. These are more common in people that have not had booster shots. People who have not had booster shots are having more significant symptoms and potentially even hospitalizations over those who have had booster shots. So it's incredibly clear. Please go out and get your booster shot this week if you have been fully vaccinated and been sitting on the sidelines. This will be able to help you through this Omicron wave. We know that these boosters work against this variant. It is your number one way to stay protected.
And finally, last question, Alex Putterman of the Hartford Courant.
Hi, I'm just wondering if anyone has any data about hospital and ICU capacity currently.
Go ahead, you guys.
So I'll just start with the fact that we know that our hospitals have been working very hard and that there are many patients who are in the hospitals. We are in close contact with our hospitals on a regular basis to be able to determine what other things we need to do to be able to handle that situation, assess that situation. Josh?
Yeah, not a lot further to add. I mean, in terms of total beds, we're at 74% capacity right now, ICU 78% capacity. That's the statewide average. Certainly some hospitals are much higher and some hospitals are not able to staff every one of their beds right now. But those are the headline statistics.
And so,
Yeah, Alex, Manisha's in close contact with the hospitals, almost on a daily basis. We're watching that carefully. We still have a pretty decent capacity, according at least to the CEOs. A lot less occupancy than we'd had a year ago, but it is something that's the key metric that we track. I just want to say that this time of the year is supposed to be one of the most hopeful times of the year, this holiday, this Christmas season. And it's sort of a mixed blessing where we are right now. The spread is something that's concerning, but the fact that on Christmas Eve, we're able to secure 3 million rapid tests, what that means as we round into January, what that means in terms of keeping your kids safe and your family safe. If we can couple that with the therapies going forward so that if you do test positive, the things we can further do to keep you out of the hospital, I'd like to think that that's the silver lining on this cloud, and that's why it's a hopeful time of the year. Thank you, everybody. Appreciate it. Look forward to seeing you all soon.